Hey everybody, Dr. Dan here, and today I wanted to talk to you a little bit about gut health and especially, more specifically, Crohn's disease and ulcerative colitis. We do have a lot of patients that are coming in on a regular basis, and those are very serious conditions and very serious diagnoses. And you really, a lot of times people have to take medication to get these things under control. A lot of times people have gone through surgeries, they've found like a sweet spot of certain medication. So why in the world would you want to do some type of holistic care or natural therapy to find out what's going on? And one thing I do want to clarify when I do say holistic care, what I'm talking about is looking at the whole body. I'm not looking at alternative things that don't have some clinical evidence behind, do they work or not? When it comes to looking at the whole body, you kind of have to take this responsibility of saying, all right, how can I at least minimize the burden on my body? How can I offset the stress or damage that the medication itself is going to cause? And at the same time, if you've had any damage to the inner lining of your intestinal tract, like villus atrophy, your ability to absorb nutrients, or you've had any resection of any of your colon, you want to do everything that you can to optimize what you do have and to optimize the ability and the efficiency of breaking down nutrients and getting those absorbed while also getting the waste out of your body. That's actually the goal, is make the body as efficient as possible and to be able to overcome some of the lack of function that the body's lost due to the long-term nature and damaging effects of these conditions. So how do we do that? Well, one, we do want to get a microbiome analysis. So we can do that with a stool test. So we can see what bacteria, if you do still have colon at all, any type of intestinal line, and any of your small intestine or your colon, we want to get an idea of the composition of the bacteria that's in there because we can optimize that. Also, there is a protective barrier in your gut, the mucosal barrier. And that's, a little bit more immunological barrier along with something called SIGA. It's an immunoglobulin A. And this helps protect what gut health you do have, but also minimize any type of sensitivities or intolerances that come along with a disrupted immune system or digestive tract. So we want to identify this non-specific and specific immunological barriers, get those as much as possible under control or assist the medications or things that you've been on, and get that gut lining as tight, those tight junctions as much as possible. You've heard the term hyperpermeability or leaky gut. We want to be able to tighten those up. And then there's something that really healthy gut bacteria produce called short-chain fatty acids. This is like a postbiotic. And what we typically find in our Crohn's patients is because of lack of diversity or long-term medications or inflammation or, like we said, resection of the colon, they've lost a large majority of the population of bacteria that produce really healthy short-chain fatty acids. These short-chain fatty acids, there's three. We got butyrate, propionate, and acetate. So we can actually measure the bacterial types. We can also measure these short-chain fatty acids. We could see, is a person breaking down their fats? How's their protein breakdown? Is their pancreas looking good as far as producing these pancreatic enzymes? So we want to get a capture of, okay, even if your digestive tract is not healthy, what can we do to make sure it's at least as healthy as possible and offset any inefficiencies or deficiencies that you may have as a long-term outcome of the disease you've been dealing with. So that's one of the first things. The rest is looking at the rest of the body systemically. All these things like the hormones and like thyroid and your sex hormones, testosterone, progesterone, estrogen, all of these things have a role on gut health, but also long-term health, and is impacted by the gut, right? So there's this crosstalk between all these systems, the brain and the gut, the hormones and the gut, the mitochondria in the gut, the energy producers. So we want to identify everything that's going on in the microbiome. We want to look at any nutritional deficiencies. We want to look at systemic inflammatory processes that are going on, and then get those things up to speed as much as possible so that you can get back to as much of a normal life as possible while even being on medications. And if you get to a point, like I said, those medications, they fail, and you have to change these things up, you're less likely to have severe symptoms. And that's our goal here, is to knock those things down as much as possible. And if at all possible, working with your doctor, if it makes sense for you and your current practitioner, your gastroenterologist or your immunologist or your endocrinologist or rheumatologist, any of these doctors that you're working with, if they feel comfortable, if we see these antibodies come down, maybe if there's less of a need for your medication, start to reduce those dosages back and just stay on the key things that you need to be on. But we don't push that. That's not our agenda. Our agenda is help you be as healthy as possible and get the maximum amount of remission, or as close to remission as possible. Hope that helps. And again, as always, if you'd like to learn more, you can find us at peakvitalitydenver.com. We work with people all over the world, local and internationally. So you're welcome to reach out to us with any questions. We have some really great webinars that are educational that you can get some information there as well. Have a wonderful day.